All right, well, we're going to go ahead and get started. Hello, everyone. My name is Carson McPherson-Krutzke, and I'm a research associate with the Natural Hazard Center at the University of Colorado Boulder. I'm very happy to welcome you to our Making Mitigation Work webinar series for September, which is hosted by the Natural Hazard Center and made possible with support from the Federal Emergency Management Agency and the National Science Foundation. This webinar series was launched in 2019 and highlights recent progress in mitigation policy, practice, and research. I did want to share a few announcements before we get started. This forum is being recorded. The caption, video recording, and presentation slides from today's webinar will be posted online at the Natural Hazard Center website, hazards.colorado.edu. And you can also find recordings of previous recordings of the sessions, as well as supplemental materials from prior webinars. You can also gain access to many other free resources, so we encourage you to check that out after the meeting today. In a few moments, I'm going to turn over the controls to our speakers. But if you have any questions or comments during the session, we're going to hold some time at the end there to address those. And so we do encourage you to go ahead and either add your questions to the chat or the Q&A box. I'll be monitoring that throughout and bring those up as we go in the end. Thanks to our partnership with the International Association of Emergency Managers, or IAEM, attending this webinar makes you eligible to receive 1 contact hour of emergency management training. To receive this credit, you are required to attend the entire webinar today, but if you fulfill that requirement, then you can go ahead and email us at hazardcenter@colorado.edu to request a certificate. You can also visit the Making Mitigation Work webpage under the Trainings tab at hazards.colorado.edu for more information. All right, well, that brings us to our topic today, which is titled Heat, Housing, and Human Risk, Lessons from the Home Forward Temperature Assessment. And today we're going to be hearing from 3 speakers who will discuss their recent project focused on heat risks in affordable housing units in Portland, Oregon. Our panelists will discuss what they learned from the temperature data and also what residents had to say about heat-related perceptions, experiences, and coping strategies. And we'll discuss some of the resident-informed recommendations that came out of this assessment. So we're really looking forward to hearing from them. So please go ahead and join me in welcoming our 3 speakers today for the Making Mitigation Work webinar. First up, we'll have Brendan Haggerty, who serves as the Healthy Homes and Communities Manager at Multnomah County Health Department in Portland, Oregon. He manages a team that addresses environmental justice and health issues in Oregon's most populous city, spanning topics that include Superfund site cleanup, lead poisoning, healthy housing, air quality, climate change, and the built environment. Haggerty has worked in state and local public health for 15 years and previously served as epidemiologist for the Oregon Health Authority Climate and Health Program. Then we have Regina Ingabire, who's the Community Resilience Outreach Manager for the Portland Bureau of Emergency Management, or PBEM. Her work focuses on public engagement initiatives on disaster risk awareness, community resilience, and household preparedness in historically underserved communities. Before joining PBEM, Ingabire worked with the Oregon Public Health Institute as the Community Engagement and Equity Manager to increase health access services to low-income communities in East Portland. She has a master's degree from Brandeis University in Sustainable International Development and a Bachelor of Arts in Accounting from the National University of Rwanda. And last but not least, we have Carolina Gomez, who is a seasoned professional with more than 20 years of experience in property management, specializing in low-income housing. With a dedicated focus on creating affordable and secure living spaces, Gomez is a respected figure in the real estate industry, consistently delivering quality services to diverse communities. She has a profound commitment to safety, emergency management, environmental justice, and grant management, and has played a pivotal role in ensuring the well-being of residents while championing safety, sustainability, and equity. So let's put our hands together for our speakers, and I'll go ahead and stop sharing and turn it over to Brendan to start. Oh, Brendan, you're muted currently.
Thank you, Carson. Can everyone see my screen? Great.
Yeah.
So My name is Brendan Haggerty. I'm with Multnomah County Health Department. That's the local public health authority for Portland, Oregon. And today with my colleagues, we're going to share with you findings from a project where we installed remote sensing temperature sensors in affordable housing units over 2 summers. But first, I'm going to give a little bit of background about how we got to the point of embarking on this project. And what you can see in this graph is that until 2021, in any given year, the number of heat deaths in Multnomah County that we would expect would be 1 or 0, really 0. The typical year had 0 heat deaths. And this all changed in 2021 when we had the record-breaking heat dome. And that occurred in June of 2021. We hit all-time temperature records 3 days in a row, eventually peaking at 116 degrees Fahrenheit. There were hundreds of deaths across the Pacific Northwest in Washington, Oregon, and British Columbia. And in Multnomah County, which has a population of around 800,000, we had 69 deaths during the event itself and several more deaths in a subsequent heat wave that summer. And we've had deaths every year since then, including 2024, which is not on the screen here. It's not just deaths where we experience all kinds of impacts. I mean, those of us who were working through the heat dome recall, our transit system basically grinding to a halt because the overhead wires on the trains were so affected by the heat. Life really stopped. We canceled all outdoor events. And a lot of people got sick. We had our emergency departments and urgent care clinics full of folks, and it was one of the most stressful times that our emergency medical services have ever endured. In this chart, you can see that reflected in the number of heat-related visits in emergency departments and urgent care clinics in 2021. We had basically 2 summers worth during 1 summer. And most of that was in the space of just 5 days in June. But we've been above that level since 2021. And the weather kind of bears that out. If you're not familiar with the National Weather Service heat risk tool, it's very much like the air quality index, where it assigns a category value of heat risk to every day. So a green day is really mild, yellow is minor, 2 is moderate, 3 is major risk, and 4 is extreme risk. And it's really those major and extreme risk categories where we're activating a response at the county and local levels. And you can see that those numbers have been large for us over the past few years. We've continued to have record-setting heat waves since that really severe one in 2021. And that includes this past summer in July. We had another record-setting heat wave that caused more heat deaths. And there have been many procedure and policy responses to the 2021 heat dome. One, of course, is that our shelter operations have really been streamlined. Instead of a kind of ad hoc situation where, we have photos of our emergency management director's car stuffed with paper plates and stuff hauling to a shelter that we opened for the first time during the 2021 heat dome. We now have a streamlined operation with facilities ready to go and trailers full of equipment and supplies ready to be deployed. And that includes mobile air conditioning if needed. There are new programs since 2021 at the local, county, and state level that distribute heat pumps and air conditioners to low-income households. That includes the Portland Clean Energy Fund, which is distributing 15,000 units to lower-income households. Oregon OSHA has adopted rules that protect workers in high heat conditions. The Oregon Health Authority has successfully negotiated a Medicaid waiver that allows doctors to prescribe patients air conditioning, basically. And and other climate resilience tools like generators if they need it. The same goes for air cleaners. As of April 2024, new residential construction in Oregon must have a space that can be maintained at 80 degrees or cooler. That came with other kind of tenant rights to air conditioning that prohibit landlords from overly restrictive rules prohibiting air conditioning in residences. And then finally, we have data improvements. One of those is pictured on the screen here, where we undertook a region-wide campaign to map urban heat islands. But another one of these efforts is what we're talking about today, which is collecting data on what it's like inside affordable housing units on really hot days. So what we did is we deployed a set of sensors like the one on the screen here in Home Forward apartments in summer 22 and summer 2023. Home Forward is an affordable housing provider, owner and operator in Portland, Oregon. We paired that quantitative data that we were collecting with surveys and focus groups among the residents. And this was a partnership between the Portland Bureau of Emergency Management, Multnomah County Health Department, and Home Forward. Over 2 summers, we deployed these monitors in 6 different buildings, which you can see in the photos here. Some of them are really large apartment buildings. Some of them are smaller wood-framed, 1 or 2 story buildings in sort of more park-like settings, and some with large parking lots nearby. So we had a real variety of buildings and also a variety of locations. This map shows the dashed line is the city of Portland border. You can see that we had locations kind of spanned across the whole city. This allowed us to gather some quantitative data like this that shows us how the buildings were performing in comparison to each other in the number of days where we were exceeding specific temperature thresholds. We also got really interesting qualitative data. And I think for me, it was surprising and edifying to learn just how radically some people were changing their behavior to adjust to heat. And so these two together have really provided us a lot of insight that help with both emergency response and long-term planning. So with that, I think I'll stop sharing and pass it to my colleague Regina to share more about the findings from the point of view of the city of Portland.
Regina, I'll go ahead and share the slides for you.
Can you hear me?
Yep.
Good morning, everyone. My name is Regina Ingabire. I work here at Portland Bureau of Emergency Management as Community Outreach and Resilient Manager. And so without pretty much what Brandon just shared, I wanted to kind of highlight how and why did our Bureau wanted to get involved. First of all, as emergency managers, we wanted to make decisions to protect life safety based on the best available information. For most of the time, when we have these severe weather events, including heat, we rely on weather forecasts. But the weather forecast doesn't give us a whole picture. It gives us information about temperature outside, but doesn't give us information about inside temperature that impacts people, especially those who are housed. So after the heat dome of 2021, as Brandon mentioned, we realized that we needed more data about indoor temperatures in order to make smart decisions and also help people stay safe in the heat. We had a really good working relationship with Home Forward, which is Public Housing Authority, and of course with the Multnomah County Health Department. And we wanted to be able to gather information from residents who live in those apartments to give us more information that would inform our decisions and post change going forward. So we brought on a partner from a local university to help us design a study and document the results, so that the information we get will be rigorous and also comply with the good practices for participatory research. So Home Forward and PBEM recognized that building residents were also important partners in this work. And the study was designed to include their insights and the experience, as well as data from temperature sensors in the apartment. Together, we designed a very simple project to monitor heat indoors in 3 Home Forward buildings. That was the initial study of 2022. And then collect information from those residents about the experience of heat and the strategies to stay cool. Next slide. So next one, I think I just went through that too. The next one too. So as I mentioned, in early 2022, PBEM proposed a project to track summer temperatures inside public affordable housing units in partnership with the Multnomah County and Home Forward. Yeah. And then PBEM contracted with the climate adaptation consultants company called Kappa Strategies. It's a local company that's based here in Portland, Oregon. The next one. So as I mentioned earlier, our main objective here was to determine when in real time that temperature is getting too hot or unsafe for people who are living inside those buildings, but also to help us collect information about indoor temperatures in different building types to inform future planning and design. As Brandon mentioned, these were initial apartments we started with, but in 2023, that's when Multnomah County actually funded the next part of the project, and we added another 3 units that we're going to see that the different outcomes in those buildings. The next slide, go ahead. So as these were all 6 properties that we installed those sensors to record the heat for several days, especially when we had hot temperatures here in the region. And most of sensors they recorded data for 85 degrees, for 80, 85 up to 90 degrees, depending on the hot days. The next one. So one thing, one of the major results we started seeing was that although outdoor maximum temperatures peaked around 4 p.m., indoors temperatures peaked around 7 p.m. and 6 p.m. And while temperatures of all 3 properties began to decline slightly after 8 p.m., the temperature tend to remain high inside because it has been accumulated over time. And the temperature outside and temperature inside was somehow, the temperature outside did not necessarily translate into temperature cooling inside the buildings. And the AC were definitely significantly helped to cool the temperature inside, plus also heat pumps that were distributed heavily, I'll say, in the year 2 compared to year 1. The next slide. So, for example, this graph here shows the daily minimum and the maximum outdoor temperatures during 2 heat waves of August 12th through 17th in 2023 and July 24th through 31st in 2022. And as you can tell, like the red arrow shows the temperatures outside and temperatures inside. You can tell, like towards the end of the after 4 or 5 days, you can tell even if the temperatures outside was cooling down, the temperatures inside were not cooling down to correlate with the temperature outside, which shows that when we had heat waves for so many days, for 4 or 5 days, the temperatures are accumulating the impact of temperature was felt most inside buildings than even when it was outside because of that accumulation of many days. The next one. And then the main highlights, really, when we compared year 1 and year 2, was that one of the most notable and surprising findings was from a year 1 study that the units with AC, air conditioning, did not register as significantly cooler than those without an AC. And temperature data, as well as input from residents at, I believe that was Hollywood East, and another apartment, revealed that even those with AC struggled to keep their indoors temperature down. And hopefully we can share also the final report with you to read in more details, was that the units that had AC, but if the next unit did not have AC, so that temperature that was accumulated by the next door unit with that AC was able to permeate through other units, especially those buildings that was wooden structure. So the temperature would really transfer from one unit to another unit. The next slide. And also another findings, we found that residents with AC shared that they went to great lengths to make up the difference using window shades or homemade insulation, keeping light and electronics off all day and limiting activity inside the home. As Brandon mentioned earlier, is that they started recognizing that air conditioning itself or heat pumps were great to reduce temperature indoors, but also behavioral change and other strategies like avoiding cooking during the day, shutting off all electronics during the day, and using window shades. All those strategies also help to mitigate temperature indoors. In 2023, the study found that 2 high-rise buildings, structures similar to the one we studied in year 1, appeared to be more effective at cooling individual units. And also, as noted, there were so few units without AC in year 2, because in year 2, I think after what I went through during the heat dome, and also first year, there was also massive campaign through different companies, especially there's also PCF, which is cooling, which Portland, I forgot what the PCF. It's Portland Community Energy Fund has disputed many air conditioning in year 2 and heat pumps. So that helps reduce number of units without AC. So I think cumulatively, we're able to see differences in terms of year 1 and year 2. And again, by comparing 2022 and 2023, data shows that indoor temperatures reached unsafe levels over 85 and 90 degrees with the great frequency in year 2022. Properties studied in year 1 and year 2 were not identical in terms of like a building structure and also building materials. And also that kind of showed different temperatures in the end, especially for the inside temperatures. Next slide. Another notable findings was that residents in year 1 and year 2 proved that both air conditioning and heat pumps are effective in keeping apartments cool, even in concrete and high-rise buildings. AC, again, as I mentioned, works best when combined with other quality insulation or use of curtains or limiting most heat-intensive activities like cooking during daytime. Also, building materials like concrete versus wooden structures that also impacted the temperatures indoors. Green spaces, actually, that was another notable outcome, was that some of those buildings that were surrounded by tree and the green spaces experienced lesser temperature compared to those who were either surrounded by large concrete structures around them or blacktops, which influence temperatures around those buildings. So in general, is that not only that AC and heat pumps helps, plus other mitigations people can take on their own, but also green spaces around those buildings and other construction materials. Also, all that impacts how those temperatures stay cool and hotter. The next slide. So these were graphs that were showing how temperatures, on average, maximum temperatures by property. And you can tell that some of the temperature kept increasing, and another one temperature stayed cooler, and another one was slightly below. And all those factors, the factors I just mentioned previously, were impacting almost how temperatures were cooling and also all going up depending on during the day. The next slide. And this was also another records showing temperatures by average temperatures by property on our profile. It literally correlates how the temperature is going up during the day and how other environmental factors around those buildings also contributing to temperatures fluctuation. And I think from here, my colleague Karina is going to give us more insights about the residents and the findings on their from Home Forward perspective. Thank you.
Thank you, Regina. Let me just get our, hi, Carolina. Welcome. I know Carolina had a few issues getting in, so let me just make sure she's able to share. Carolina, do you want me to share your slides, or would you like me to do it? Or would you like to do it?
I have it here. I just joined it, so I'm just trying to, yeah, if you don't mind sharing them for
Yes.
now.
Let me just get them. Here. All right, can you see that?
Yes.
Okay, perfect. And then just say next slide whenever you're ready.
Thank you. Next slide, please. We'll continue of what Regina has been talking about. And this was in collaboration, and it has been said already, with PBIM, the City of Portland, Home Forward, and Kappa Strategies. Next slide, please. And I wanted to share a little bit of the why and how we did come up to this project. We were receiving reports from the residents and staff with very common and similar complaints about it's hotter inside of the building than the outside. It's very hot at night. We can't sleep. People get more agitated, more violence, more issues in our community. And people telling us that their AC is at full capacity and it seems it's not working or is working harder. We do house the most vulnerable people and residents in our community, and we wanted to pay attention of what was going on. So we start talking about sensors and installing our own sensors, and thankfully in a meeting with many other people from the county and the city, where they were present, and we were talking about decisions. And then this is how we start talking about the sensors, and this project was able to happen. Next slide, please. With this report from Kappa Strategies, we were able to put into like the theory or the complaints into facts, and we were able to identify that yes, the symptoms of the people that was part of this project, they show that there was more difficulty falling asleep or staying asleep because of the heat, and more stress and anxiety. So this was part of the survey, and these symptoms are real, and it is happening. And it happened through the heat waves, and we got to get the actual symptoms and learn more from our residents. Next slide, please. With this report also, we were able to identify that, yes, in fact, after the temperatures outside get cooling, the actual building, it gets or the same or higher temperatures, or it take longer to the building to cool down. So these charts show us that when it's time for many people to go to sleep or to be at night at home, the temperatures are higher in the units, and it takes a long time, depending also on the building materials, on how these buildings are going to cool down. Next slide, please. These are the average days and the heat average days in our properties. And you can see that every property behaves different. And the amount of days, particularly if you look at Northwest Towers, that this building stays hotter. And it's the location, it's the materials. There is all of these things are to be considered in the actual temperature of the building. You'll be able to see with this chart that it does have more higher days than the other properties. Peaceful Villa, it's a garden style property. It's not a high rise like Hollywood is or Newmarket or Northwest Towers. So you will be able to see the differences between the temperatures on the buildings. Next slide, please. These are the properties that we consider, and this is also in another slide. Next slide, please. And also the mapping from us of where the properties are located. Next slide, please. Summary of building characteristics. So you may have heard from the other buildings, but I wanted to talk about Hollywood East, Northwest Towers, and Peaceful Villa. 2 high rises and 2 garden property. Next slide, please. And here are some of the barriers of why people is not opening windows, when they're not looking for a place to cool down, and etc. So this is a lot of things for us to learn as we are providing services and housing to our residents, and want to why there's barriers for people to do this. Next slide, please. The recommendations from the study. So there was building improvement recommendations to install central or expanded air conditioning, and we are actually working with PSF right now, installing ACs, portable ACs in our properties. Window screen installation. A lot of affordable housing buildings don't have screens on the window. So this is something that it came out through this program, and we are hoping to be able to do this installation in the near future, or to consider it in the new buildings when we are constructing new buildings. Blackout curtains or shades, enhanced insulation, and tinted windows was additional recommendations. The resources, extended hours of on-site cooling centers. So some of our buildings have community rooms that we use as cooling centers, and with the chart that we showed you earlier, you'll be able to see that the buildings stay hotter. So we need to increase the times or the hours for the on-site cooling centers, not only during office hours when our on-site staff is at the buildings, but we have to look for ways of keeping them open until later, so the residents have an opportunity to cool down for a longer period of time. Access to cooling resources of information. So we are providing to our residents additional resources, information coming from the city. I think that we've learned that having these resources posted in the website to be able to provide it to our residents, and we print information for those that don't have internet access, so they know where are the cooling shelters or where there are information where they can also look for alternatives. Health and safety support, additional fines and portable ACs, which again, we're working with PSF to do this, and social activities and support networks. And this is part of the resources we provide to our residents. Next slide, please. Thank you.
Thank you so much, Carolina, Brendan, and Regina for that summary. Let me go ahead and stop sharing, and we'll have the rest of the time really for questions, which is great. Let me see why video is not on here. There we go. And we've been getting a few in the chat, so let me take Carolina off of Spotlight here, and then we can see everybody. There we go. Great. Okay, so let me just see what questions we had first. There was one question for Brendan early on from Robert, and he said, do you believe your data and study will lead to improvements to building codes, residential and businesses in Oregon?
Well, things have been moving so quickly that, it would be hard for me to attribute anything to our findings specifically, but I do think there's something that's pretty interesting here. In the recommendations, it focuses, on first addressing the building and the building envelope. And I think that can influence programs that have resources available to retrofit buildings, right? Which is different from a building code or a policy that applies to new construction. The other finding that I think is pretty interesting or the recommendation is that once you've addressed the building itself, focus on the surrounding area and the risk factors or protective factors that exist in the immediate environment. And the thing that stands out to me about that is that in year 1 and year 2, we had 2 properties that were fairly similar in the building type. They were sort of 1 and 2 story wood buildings. But one of them was in like a very park-like setting, and the other one was basically surrounded by blacktop. And you did see big differences between those. So I'm hopeful that this helps us, even if whether or not it gets enshrined in policy, it helps us address the risk factors near buildings like large, extensive impervious surfaces.
Awesome. Thank you, Brendan. And then there was a question about the AC units. So it was interesting that, some of the units, even that had AC, were still struggling a lot. So Maggie was wondering, did you ask about how people were using the AC units? So were the settings set to cool? Was it because they weren't using them as much, maybe because of cost concerns? Or can you just talk a little bit more about what were some of the issues there, even in the places that did have air conditioning?
There were many factors. One of them could be the size of the AC that was not for the size of the apartment, or they had only one AC that for a large space. But also we found that if a AC is working in a unit, particularly in a high rise, when the units above, below, or on the side don't have ACs and they are warmer, it takes longer to the unit to work more effective. So ideally, everyone is cooling their space, but it is not a reality. And also there's problems with the electrical load of our buildings. A lot of our buildings are very old, and we start having electrical problems because the building cannot take when it's too hot, and then we have to start having electric problems. We'll not be able to take ACs in every room, in every building. So this is one of the problems we are trying to work with, to be able to support our residents to have more ACs. But also it's some people, we found that some people had ACs and they opt to not to turn it on. It's not hot enough for them because of the prescription they are taking. They cannot feel the heat, or because they don't want to use their electricity, or they are afraid that their electricity is going to come up. So we are offering resources for our residents for these things, but there are multiple factors of why this was happening. So learning of those factors was an eye-opener for us.
Yeah, thank you so much, Carolina. And Regina, I see you nodding your head. Did you want to add anything to that?
Yeah, I want to add something to that too. In addition to what Carolina said, in the second year, 2023, there were many AC units that were distributed and heat pumps. So it kind of helped to reduce like those units in 2022, because very few units had AC. So the more units that had more ACs and heat pumps also did somehow reduce that indoor temperature.
Thank you. All right, let's see. Oh, I think you kind of already answered Mark Schaefer's question, but was asking about what was the surrounding landscape like? It seems like, where those places that had the black tops, right? The heat was going to be a lot higher. There's another question that was sort of related to that. Has Home Forward considered putting in like white roofs or reflective coatings on blacktop or anything like that? I know there's been some work in New York City on painting rooftops white and seeing a lot of heat reduction there. So whoever wants to answer that, go for it.
We have discussed that. We have not yet made plans on this, and there was also the conversation of painting parking lots white. There has been some information right now. What we were working was also increasing. There's a tree canopy that could help with these things, and this is where our focus has been, working with longer ways of how we can help with these programs, like and the temperature, sustainability, electric fleet, charging stations for the long-term help for our environment. But for short-term, we are also opting to increase our canopy in our property. So this is one of our projects that instead of painting the parking lot white, that we could have more trees in the parking lot.
Yes, a co-benefit of sitting under shady trees. Yeah. All right, there's another question from Anne who said, when I worked for an architecture firm, the NPS gave us problems about putting windows in a historic Section 8 apartment building. My response to them was that the building was designed to be almost punitive in nature and without windows, that didn't feel humane. We had to mitigate for removing historic material. Do you think the information you gathered would have been a good argument for allowing us to put in windows? The building she's talking about was in Atlanta, Georgia.
I can tell from our perspective, we have some buildings in historical designation for permits, and we do have problems with that. As of today, we have not used this data to be able to work with the city, but this is what we wanted. This is why we wanted this data. So it is too soon for us to show facts of how we use this data to do that, but we have the similar problems with our historic buildings, and the flexibility and the ability that we have to put more, to make changes in the building to make it more resilient for the heat. And then I think we will be able to use this data, but I don't have anything that can show us a fact. Too soon for that.
Brendan, did you have something you wanted to add there?
Well, I mean, I'm from the health department. Of course, I think it's more important to protect human health than to protect historic building materials.
Yeah, that seems like a good justification. There's an interesting question about what kinds of questions that maybe didn't get answered in this initial study, but you're curious about now that you've done it. So Sky asked, can you speak to any of the questions that came up that you were not able to address or future research directions that you have? And maybe each one of you could answer this one, because I think that's an interesting one.
I can start. I think there's a section in the report called unexpected findings. And I think it's kind of full of questions that are worthy of further research. One is that, window direction and building story didn't really seem to make a substantial difference. And, I don't think that really stands up to like the mechanistic or the mechanical knowledge that we have of frankly physics. So what's going on there? Are we seeing behavioral adaptations that basically reach the level needed to even out those differences, or is there something else going on within the building, but still worth further investigation, I think. And that includes, we didn't get really strong findings on tree shading as a protective factor either. So I guess that means window direction, the story of the building, and the presence of external shading, I think all need further investigation.
Thanks, Brendan. Carolina and Regina, do you wanna, yeah, go ahead.
Something that I work in property management for 20 years before working in safety, and something that we assumed, that we thought, is that the upper the level, the hotter was going to be, and we found out that was not a reality, that it was like an oven, that it was more in the units in the middle of the building will have more heat. So finding that was actually news for us, and having the science behind that was an eye-opener for us. Also the materials of the building and seeing how each building behaved differently. It was news for us. Something different also is when we originally thought about putting the sensors, we wanted to do it in the hallways, but the residents' belongings, how their behavior of opening windows, opening doors, having drapes or blinds, all of these things have a big impact on the temperature of the unit and the building. So it is the hallway temperature reading is not going to provide the essential data as it is inside of the building. Some of the participants also removed the actual sensors because they thought we were able to listen to their conversations, because they thought there was cameras. So also having a trauma-informed approach and understanding of some of their thoughts, it's important to have in consideration for a project like this.
For me, actually, after reading this report, I know, like, our bureau came from emergency management perspective, wanting to know that we rely on weather forecasts for temperature outside, and I feel like our response system, our response activity and strategies are based on temperature outside. Now that we know how that temperature actually translates to indoors and how it impacts people who are in the buildings, makes me think about other bureaus that could also be involved in this work. For example, like the Bureau of Planning and Sustainability, actually, that house the PSAFE, which is the Portland Clean Energy Fund, and invests heavily in increasing tree canopy, increasing other environmental behaviors, including providing the AC and heat pumps, mostly to low-income communities, but also with focus in urban heat island areas. And also made me think about the bureau, like Bureau of Planning, Bureau of Environmental Services, also, which including other bureaus that handles like construction permits and zones and those building codes, that literally should be corrective approach, like from statewide, from other bureaus, and also see what angle they also can come in to help support this initiative further, because not only 3 agencies that were involved here that will be able to solve this issue, but needs to be looked from different angles and from different bureaus and perspectives, and actually make investment into this type of work to make sure that we can be able to cope with excessive heat, which has become almost a norm. Every summer we expect this to happen.
Yeah, and that made me think of now in the summers, it's not only heat, but it's also smoke and wildfire issues. And so I'm wondering, did this study look into any issue? Like, of course, open the windows, that's what people want to do to cool down, and then that brings heat in and causes other kinds of health issues. So are there thoughts on any recommendations that were, or was that looked into at all in the study, or do you have any thoughts on any of that?
We originally had hoped to place air monitors in apartments as well. It's a lot trickier because our wildfire smoke incursion events are much less predictable than our heat ones. But one finding that sticks in my head from this is that people were pretty willing to use a cooling center if it was on site. And so to me, that suggests that the same thing would be true for a cleaner air shelter. or a cleaner airspace. So, even if we can't provide air filtration in every unit, we can provide a respite space that people are likely to use on site.
Thanks, Brendan. Carolina or Regina, do you want to add anything?
Brandon is right. We have a lot of participation from our residents in the in-house cooling center, and we do provide some, when there is air quality issues, we provide an air cleaner for those community rooms. Ideally, yes, we will be able to include the air quality in this project, but the sensors were only doing the temperatures. There are other sensors that have more robust testing, or they are looking into more things, including heat and air quality. They are very expensive. So when we were looking into that, the cost was prohibitive for us to do. And ideally, as we are learning more from this, we have more supportive documentation to help us create more testing and more pilot projects to be able to continue doing this. There was another thing that was really important for this project was when it was too hot, it will send notification to people. And some people response was, yes, I know it's hot. I can feel it's hot. But for some people, it was actually important to have a reminder or somebody looking for them, even when it's a computer-based response, that somebody was reminded that, hey, it's getting too hot. Please look for shelter, look for information. So the inclusion of our residents because of capacity or response or not looking at the news. This is something else that we learn. A lot of people just choose to not to listen or not to have social media, not to look at the news because it's overwhelming to them. So having this type of flags for them to remind them it was important. So the air quality and the heat is another project that we hope to be able to fund in the future. And to respond to, I think that no air conditioning in the design of the buildings. These buildings are very old. These heat issues, when those buildings were designed, we were not having the heat issues or the extreme weather that we are having today, because it's not only cold, we also have a severe winter storm this year that froze many of our pipes that create another set of problems. So the extreme weather that we are seeing in our area, it's very new. We didn't see these things when these buildings were built. So this is something we are trying to work on.
Thank you.
Yeah, I agree with my colleagues. This study could be expanded, looking into air quality, especially wildfire. Like few days, even like maybe 2 days ago, we had like haze air quality because of fires burning around this area. But even if temperature cool outside, you want to open windows, but you don't open the windows at nighttime because you don't have that smoke getting in the house and causing breathing issues. So I agree, there's a lot of work to be done. And as you see, climate change making these like wildfires extreme, heat waves extreme, ice storms extreme. These are kind of new concept literally here to Portland area.
Yeah.
And I think there's a lot of work to be done, but this is the beginning.
Thank you all. All right, there's another question from Nicholas who said, for the barriers table that you shared, Carolina, were those responses based on a survey of residents, or can you talk a little bit more about how you gathered that data? And then did you have counts of like how many people had issues with, crime or what the various other things were in that table?
Yes, it is from the residents. There was a survey and there was also in-person meetings where they captured this data. We offer translators in the meeting, so it was DEI was very important for this project, so we were able to capture that information. And there is count of how many people. So yes, all of that is in the reports, and there is 2 reports where you will be able to find more information. In the barriers table, also people was explaining why they were not opening the windows. So if you look at this section, they said, yes, air quality, smoke from the outside because of the lack of screen, bugs coming to the unit. And we found that a lot of our residents were just not opening the windows, for the noise, for the buses. There's a lot of things to consider. So if you have the capacity and the time, please take a look at those findings.
Kind of a good question to go off of that one was there any state or federal government support or interest in this study? And are there plans to replicate it in other cities?
I can answer part of that. For the second year of the program, it was supported by a CDC grant aimed at reducing health disparities. I'm not aware of plans to replicate this in other cities, although in part it was based on a pilot from Maricopa County in Arizona, where they placed sensors in housing units that alerted a medical care team when a vulnerable resident was experiencing hot indoor temperatures.
The help that we got was from the county and the city present here. Without their help, this project would have not been able to happen because of other priorities we had in our buildings, including the ACs and the installation. We're working with VSEF. So because of capacity and funding, this project would have not been able to happen without their support. Ideally, we would have tested other properties. We were focusing in some of the high rises. We did a couple of the garden style, but there was a lot of other properties we wanted to test. Ideally, we were able to install some more additional sensors. It was a very small capture of data. Ideally, we will be able to track more time in the same buildings and track more data to be able to see not only heat, but winter, how cold the units are getting in the winter. So there's a lot of other things that we could look in to get the data with a long-term project. Unfortunately, without this funding and capacity, we would not be able to do it without their help. So.
Thank you. We have a couple minutes left. I really enjoy ending this with just seeing from each of you, what is one thought or takeaway that you want people who are here to leave with? So let's go ahead and start with Regina. We'll put you on the spot, and then we'll do Brendan and then Carolina.
I think for me, what I have observed from like my colleagues and my family, before the heat wave is here, now we expect it, whether it's gonna happen or not. So we started planning ahead of time and putting those mitigations I mentioned earlier, like make sure you have the right curtains, make sure you have, if that tree you're planning to cut, maybe don't cut this time. Planning even your meal time, like you're gonna cook at night time and during the day, you don't have to use a lot of heat appliances during the day to maybe get additional heat in the house. I think that those helps, but also to really remember checking on your neighbors. That has been our message all the time, because some of us, sometimes we make assumption that everyone has a house, though, that's no problem. But we found out that unfortunately, many people who passed away during any of those heat waves, there are always people who live by themselves. So it's really key that when you're planning for your family, we also plan to check on your neighbor.
Thank you, Brendan.
Yeah.
I think a takeaway that I have from this project is that in the absence of air conditioning, people were altering their behaviors in pretty radical ways. Freezing a t-shirt and wearing it, foiling over their windows, foregoing the use of any electrical appliances in their apartment during a heat wave, in ways that are really burdensome. And to me, that makes air conditioning seem comparatively really humane.
Thank you. Final thoughts, Carolina?
The vulnerability is real, and this is a really nice way of showing the facts behind that. So for people that is looking for some of the background information of facts, I think this is a really good report to show that. And the really good takeaway is the relationship building. This project would have not happened if we were in a meeting with these emergency managers that had just a crazy idea. What somebody thought, well, it was a crazy idea. Like, who thought of doing this? It was an idea that we talked, discussed, and it happened. So first, there's no crazy ideas. Second, it's relationship building with other agencies and keeping these conversations alive are very important for emergency management and preparedness.
Thank you so much. And I know we're at the hour, but I just have a few quick announcements before we sign off. And I just want to say thank you so much to Regina, Brendan, Carolina, and for the many other contributors to this outstanding effort. It's really impressive and needed work. We also want to thank FEMA and the National Science Foundation for making this webinar series possible. And we're so thankful to you all for joining us today. And just a few announcements again, reminder to submit continuing education credits by emailing us if you want one of those. And then I also want to say to save the date for our next month's webinar, which is going to be focused on living by the levee, navigating flood resilience for unsheltered communities. That'll be on October 8th from 11 to noon Mountain Time. So please go ahead and register for that. So now on behalf of the entire Natural Hazard Center team, we want to thank you for being here. Thank our panelists again for this wonderful presentation. And we look forward to seeing you in September. So thank you so much.
Thank you for hosting too.
Thank you all.